Are dental implants painful? Are they too expensive? And are you even a candidate if you've had dentures for years? There's a lot of information online about dental implants, and honestly, a lot of it isn't true. I'm Dr. Travis Wills with Shady Spring Dental Care, and today we're going to break down some of the most common myths about dental implants, All-on-X and overdentures. A lot of patients ask me this before they get implants. Most patients think implants are painful, but is it actually true? Most patients think that dental implants are going to be painful, but what they report back to us is with anesthetic, the different methods that we have of placing implants and the types of sedation, that really pain is not a concern. One of the biggest concerns patients have is cost. Most people assume dental implants are too expensive, but is that really the case? Dental implants are an investment in your mouth. They are not expensive. When you consider how long they last, dental implants pay for themselves. This is something we hear about dental implants all the time. Many people think they're too old for dental implants. Is age actually a problem? Age isn't a problem. We've placed implants on patients ranging from 18 years of age all the way up to 95, and they've had tremendous success. Patients who have worn dentures for years assume this one thing: if you've had dentures for years, does that mean implants aren't possible anymore? Actually, even if you've had dentures for years, implants many times are still possible. When you see us at Shady Spring Dental Care, we do a comprehensive consultation and we use a CBCT to evaluate your bone to see if implants are an option for you. Patients researching full arch implants often think this: do All-on-X implants actually take years to complete? All-on-X implants usually are done within 6 months, sometimes within the first day. It all depends on your bone and the quality that we're working with when we're placing our implants. One of the biggest frustrations with dentures is that they move around. Do implant dentures still move like traditional dentures, or are they more stable? Implant dentures are much more stable than traditional dentures. The implants act as anchors, keeping your denture in place so you can eat more foods than you can with traditional dentures. And the more implants you have, the more stable your denture is. Oftentimes, they feel like you're using your natural teeth. This is a concern we hear a lot. If you've lost bone in your jaw, does that mean implants aren't possible? When you have teeth extracted, you start losing the bone in that area. But upon examination, sometimes we find that in areas where you've been missing teeth for years, we're still able to place implants. With our exam and our CBCT, it's easy for us to evaluate if there's enough bone for implants. Some patients worry about how their dental implants will look. Do dental implants actually look natural? Yes, dental implants do look natural. Before you get your final restoration, we make sure that you know what to expect during the healing phase and can often show you your smile before we're ready to hook it to the implants. Patients sometimes read things online that worry them about implants. Do dental implants fail often? Dental implants actually have the highest success rate in all of dentistry. Here at Shady Spring Dental Care, we use the advanced technology, and with our years of surgical experience, our implants are built to last. One of the biggest questions patients ask us about implants is longevity. How long do dental implants actually last? A properly placed dental implant should last decades, if not your lifetime. Here at Shady Spring Dental Care, with the proper approach and the right team, our dental implants can last a lifetime.